The last question, I'm going to open it up to the panel. Can you tell me what are the most important things to consider as choosing a service or choosing an organization or a hospital on where to have your baby? You want to start?
I'll start.
Okay.
I know it's often asked to me when I'm out in the community and talking about what I do, people will say, well, what is there out there that keeps my baby safe? That is a huge question in a lot of moms' minds. They don't even think about themselves a lot, but they're thinking about that newborn, and they want to know what's going to keep their baby most safe. So I think that's huge in direction to our OB-ED that Christy talked about. It's 2 o'clock in the morning. This mom's got a pain. She can't understand. She's concerned her baby's not moving enough. We're here. Come on in. Those nurses are going to take care of you. The physician is there ready to see you. If you are one of those 1 in 10 that something goes wrong and you need a NICU, we're it. We don't want you to need that NICU, but if you need it, we want to be here for you. Even our security system. The world is a scary place sometimes right now. So our 5th floor and 4th floor are equipped with a state-of-the-art security system that your baby receives as soon as they're born. Before they leave your side, that baby has an electronic security device. All of the staff are trained very well to watch, and they know what to look for. They get abduction training every year. We're going to teach you how to keep your baby safe once they get home. You get home and the baby has a temperature on day of life 3 and you're scared to death. Well, that's what pediatrics is here for. So I think safety is probably one of the biggest things, and I feel like by far St. Bernard's has that covered.
Yes, I'm gonna piggyback off of that. Safety is really important to us. We do lots of education and lots of discussion and training. Safety is a big thing. Maternal mortality is a really big topic right now. Women in the United States die during childbirth and pregnancy more than any other industrialized country, which is really scary. And we've come a really long way in our department to help keep moms safe. We have lots of things in place to keep you safe while you're pregnant and after you deliver. We actually just recently implemented a new postpartum hemorrhage tool called JADA that is really beneficial for our patients that have any kind of abnormal bleeding after delivery. It works within minutes to hopefully save someone's uterus and possibly save someone's life. Bleeding is a really big thing that's normal after delivery, but when you bleed too much, we do not want that, especially with blood shortage these days. We want everybody to go out and donate blood, but we don't want you to have to need to get blood if you're pregnant or delivering. We also have a very, very much improved C-section rate from years past. In the country, in the United States, the C-section rate is somewhere over 30%, which is very unnecessary. It's a very common surgery that's performed with a lot of risks that a lot of people don't think about on a day-to-day basis as to what could happen with multiple C-sections. So our C-section rate has gone down drastically, especially like I talked about earlier with the spinning babies, the positioning devices, things like that we implement. And we have I think our C-section rate most recently was in the 20%. So it's lower than the nationwide recommended rate currently. So we're working closely to lower that also. We want to get as low as possible. And our episiotomy rate is also very low too. That's also a hot topic. I won't go into great detail about that, but it's nice to know that we do everything we can to keep moms safe and babies safe while they're in the hospital delivering with us. That's a very big topic. We talk about that every day. We have multiple discussions throughout the day with all of our women's and children's team and then throughout the hospital about safety, any issues we've encountered and what to do to prevent those from happening in the future. It's always on the forefront of everyone at St. Bernard's mind.
We are the only hospital in Northeast Arkansas that provides an outpatient lactation services that's full time. And you're as a mom and you just deliver a baby and you've chosen to breastfeed, you're not in the hospital for very long, 24 to 48 hours. That's not a lot of time to learn a new skill or for your baby to figure it out. Babies are not born hungry because they've got a belly full of amniotic fluid and mucus, and their belly's about this big for the first 3 days, which is not very big, and so they just need some help, and they're born wanting to suck because their world's been turned upside down, and they're wanting to suck for comfort, so not really for food. So what happens is they get discharged, the milk comes in, the change of the breast changes come into play, and the breast kind of swells up, and the baby looks at mom like, what is this, and how can I get milk? And so mom's just kind of sitting there thinking, I can't, what's going on. So she calls us, we get her into our clinic, and we've got a fancy scale there that we can actually tell how much baby is getting when baby nurses, because that's probably the biggest thing I get is, how do I know my baby's getting enough to eat? And we teach moms this because it's very easy to determine if your baby's getting enough to eat. So, we're real proud of our outpatient program.
What I wanted to do is kind of draw it all together here. From my perspective, the most important part is just the holistic care, starting from Angie's clinic, the prenatal clinic, which, by the way, I think I would love to say as a neonatologist that the NICU is the most important part, but realistically, a lot of my business comes from lack of prenatal care, a lack of a healthy pregnancy. And a few years ago when Brenda announced that St. Bernard's was going to be going through the steps of creating this prenatal clinic, I thought that was going to be the single biggest thing we could do to improve the health of moms and babies in this area. Far and away, even above the NICU, is just starting off with a healthy pregnancy. So the pregnancy clinic, for one. The OBED was another innovation that most hospitals don't have, a specific emergency department for obstetrical issues, whether it just be some preterm contractions and you just need a little hydration, or whether it be that you're having severe high blood pressures and you need to be delivered because of a condition called preeclampsia. Even though it's 12 weeks early, you've got to be delivered because your blood pressure is getting to a life-threatening range. And of course, the obstetrical hospitalist program, where we have obstetricians in-house 24/7 to evaluate those moms in the OBED, or to evaluate moms who are in the process of laboring when issues come up during labor. And then, of course, then there's my part, the NICU, which, if your baby doesn't have just a normal, routine, easy-peasy delivery and comes out crying and starts to suckle and decides to become a perfect little angel, if they decide not to do all that perfection, then they sometimes, about 10% of the time, become patients of Danielle and I. And we're prepared with a highly qualified team of nurses, respiratory therapists, and physicians that help to make sure that baby's transition from life inside the womb to life outside the womb is as easy as can be, even when severely premature, or even when other conditions such as infection around the time of birth have set in, and so forth. And then after delivery, or after the baby is, whether on the postpartum floor rooming in with mom, or whether in the NICU, to have lactation support 7 days a week. So the whole picture all drawn together, from prenatal care to obstetrical emergency care to labor and delivery, postpartum rooming in and newborn nursery standard care, and neonatal ICU care. We offer it all at St. Bernard's, and I really think that's what's important to look at, is where can I go where, if there's a problem, whether during prenatal care and needing level 2 ultrasounds and angels, to help assist with the pregnancy, whether OBED and labor and delivery, whether routine newborn care, whether NICU care, where can my baby go? Or, as a husband and father, where can my wife go to make sure that things go as normally as possible? And when things aren't normal, where can she go, or where can my baby go, where when things aren't so normal, they can get comprehensive care?